I'm going to guarantee you won't be able to recover completely without the help of physiotherapy. If you have suffered from stroke and you want to get back to your life, then you will need physiotherapy. Here are some 11 reasons why you should take physiotherapy as soon as possible. Here are 5 exercises that you must do on your bed while you are lying with paralysis. Mirror therapy works like magic for you. Yes, it's true. If you don't exercise, you won't be able to walk. Hello friends, I am physiotherapist Meghna Dave, and in this video, I'm going to open your eyes and tell you why you need physiotherapy as soon as possible while you're suffering from stroke. That's not all. I'll also explain you some simple exercises that you can do on your bed while you're recovering from your paralysis attack. And I'll also share with you some important magical aspects or miraculous outcomes that you can achieve just with the help of consistent practice and use of mirror therapy. Let's get started. Friend, if you have suffered from stroke and you are someone who is recovering from your stroke attack, then I bet your doctor would have definitely recommended you to go for physiotherapy sessions. Well, I know it's an out-of-pocket expense sometimes, and that's the reason a lot of people who suffer from stroke believe that no, they will walk automatically and then they don't seek help of physiotherapist. But this is one of the biggest mistakes that they make. Here are some 11 reasons why one who suffers from stroke should definitely take physiotherapy as soon as possible. Reason number 1. When you take physiotherapy, it helps you to restore your mobility. It helps you to restore your movements. All the physical activities and exercises that we incorporate in your physio rehab session are directed towards your functional task that you will do in your day-to-day life. If you want these muscles to initiate and work and function the way they used to do before, you need to retrain them, and that's what physiotherapy exactly do. Reason number 2. Physiotherapy helps you in prevention of secondary complication. Imagine you're going to be on bed for a couple of days, maybe a couple of months. Obviously, there are going to be some secondary challenges and complications that will come on the way. If you want to prevent them, then you need to make sure that you stay active and you attain physical activity as soon as possible. Reason number 3. Physiotherapy will help you to get back to your activities of daily living. Remember, before stroke, you used to nicely walk. You used to go for your walks, you used to do all your household chores, you used to work as well. But all of things comes at standstill. But physiotherapy rehabilitation will help you so that you can retrain yourself in doing all of these activities. Reason number 4. Physiotherapy will help you to improve your balance and coordination. Balance and coordination is very crucial when it comes to your standing, walking and sitting abilities as well. You would have experienced that when you try to sit straight or erect, you tend to lean on one side or fall on one side. This can be prevented and managed with the help of physiotherapy. Reason number 5. It improves your muscle strength. You need good muscle strength in order to do your functional task. How you're going to regain these muscle strength? Do you think it's going to come automatically? No, of course not. You need to do exercise, and that's what physiotherapist will help you to do so. Reason number 6. Relearn your functional skill set. You would have observed simple tasks like picking a pen, writing, or else passing on an object from one person to other, which were very simple. We never used to think about it, now has become such a tedious task. How in the world you are going to learn all of these things again? Definitely it's the physiotherapist who will help you to learn all of these activities. Reason number 7. Definitely when your muscles are paralyzed, your body is not well aligned. This increases the risk and chances of you experiencing body pains. You can also experience muscle injuries, ligament tears, etc. Sometimes in severe cases, people with stroke also experience shoulder dislocations. All of this can lead to severe pain in the body. This pain can be managed and kept under control with the help of physiotherapy. Reason number 8. Improve your physical abilities or physical fitness. You need to be fit to live an active lifestyle. Your cardiovascular health or fitness is equally crucial is your functional movement. How are you going to attain this? Definitely with the help of physiotherapy. Reason number 9. Gait training. Yes, physiotherapy's major role in stroke rehabilitation is also gait training. Gait is your walking style. Now you would have observed when people suffer from paralysis or stroke, their walking style changes. It becomes altered, and that leads to increased risk of fall. If you are someone who wants to make sure that your walking style is better, definitely you need gait training, which is very important part of physiotherapy rehabilitation process for stroke. Reason number 10, spasticity management. One of the biggest hurdle an individual faces in his day-to-day life while suffering from stroke is spasticity. Spasticity is nothing but high tension in the body. This spasticity can be reduced to a lot of extent with the help of physiotherapy exercises and techniques. And 11th reason, last but not the least reason why you should start physiotherapy as soon as possible is it will make you feel better. Yes, it will promote your emotional well-being. You heard me right. See, when we walk or do any kind of physical activity, your natural dopamine levels raises. This makes you feel happy about yourself. It makes you feel good about yourself. Remember in COVID times where we were stuck inside our homes, what came at the toll for majority of the people was their mental health. Because we as human beings are social animals. We as human beings needs movement in their life, and when these movements get compromised, that's where all the other challenges begin. So if you want to stay happy and healthy, then you need to move for sure. So aren't these 11 reasons enough for you to start your physiotherapy journey as soon as possible? Of course it is. But now let me tell you some additional tips that you can incorporate in your day-to-day life so that you can recover from your stroke better. Number 1. When you suffer from stroke and when you are out of your hospital and at home, then there will be 3 common phases that you will experience. Your phase 1 will be your phase where you would be bedridden. You would have not achieved that level of balance that you can sit independently, stand independently, or walk independently. This is where the highest amount of exercises are needed. Here, the exercises are going to be bed-based exercises and weight shifting exercises. The second phase that you will land up into will be a partial recovery stage, where you have attained certain level of balance and coordination. That's where with support you would be able to sit, you would be able to stand, you would be able to walk. And the third phase will be the phase where you have achieved certain level of functional independence but with altered level of movements. Here the spasticity will be there and you would see your ability to stand independently, walk independently, even though has come, but your leg and the hand doesn't move in the right way. So in all of these phases, there are different exercises that you should do. So here are 5 exercises that you should do while being on bed. Exercise number 1 is ankle toe movements. Yes, you heard me right. You need to try to move both your legs up and down as if you are moving your ankle and toe upward towards your body and downwards. This will ensure that there is good blood circulation in your body. The second exercise that you should do while being on the bed is weight shifting. Take help of someone. Make sure that you bend both the knees and then try to put weight on one side first and then on other side first. I know on the paralyzed side it will be difficult, but still, trust me, if you do this process, you will eventually be able to follow the exercises. Exercise number 3 that you should do is called as pelvic bridging. Here you're going to bend your legs again, keep your hands on side, try to put as much weight as possible on your hands and try to lift up your waist. This will ensure that your spinal control develops. Exercise number 4 is turning from one side to other side. Turning is very critical. While you would be able to turn very easily on the affected side because the non-affected side is stronger that you can use to pull yourself, turning on the non-affected side would be difficult. Here you might need initial help, but with repeat practice, you would be able to turn yourself well. That's not all. This will also help you to prevent the pressure sores that can develop over a period of time when you are bedridden. And the 5th exercise that you should do while being on bed is something called as arm raise. Yes, your arm stiffness is a very big complication that can give you neck pain, shoulder pain, even back pain. But if you do your arm raise exercises regularly, you will be able to get better movements. So these are the 5 exercises you should do in the initial phase of stroke. Now let's see the exercises that you should do in the second phase of your stroke attack. Here you can sit with some support. So your idea should be to focus on developing that independence level. So try to spend some time sitting without support. You can take help of some pillows or someone who is your caregiver to ensure that you spend maximum time in sitting. Very similarly, encourage yourself to shift your weights forward and backward and side to side while sitting. This will ensure that your ability to transition from one side to other side gets better. The third thing that you can do is turning on side to side while sitting. Once you have developed the ability to turn side to side in sitting, try to practice sit to stand activity. It's okay if you fail, but keep try. This will ensure that your ability to sit to stand gets better. And last thing that you should also practice is standing independently. These are the exercises that you should do in phase 2 of your stroke recovery. And the exercises that you should do in the phase 3 of stroke recovery are more complex and advanced exercises. Here you have to focus on improving the patterns of movement that you are having. Majority of time, if you see, when you walk, your legs will be rotating. Your hands will not go very smoothly up and down. There will be certain restrictions that you will be facing. So here doing exercises will be helpful in front of mirror. Remember, mirror is very effective when it comes to getting improvement in your stroke recovery process. I'll come to that point in later sometime, but remember to do the exercises in front of mirror. And in the later phase of stroke rehabilitation, the most important aspect where you should focus is your thumb and hand movement and your foot movement, because foot drop and wrist drop are the biggest complications that exist or persist for longest period of time. This is where all your functional abilities lies, and this gets limited if you have got foot drop or wrist drop. So that's something that needs to be worked on. So here, as I mentioned, mirror therapy works like miracle. So how to use mirror therapy in your stroke rehabilitation process? So try to do all the exercises that I mentioned in sitting and standing in front of mirror. That will add up. But you can go one step ahead by using mirror box exercises. Here you might need help of physiotherapists, but studies have proven that when you do hand-based exercises using a mirror box, the effectiveness is way more higher. In the mirror box exercises, there is a mirror that is placed in front of you, where you place the normal hand in front of the mirror and the affected hand back side of the mirror. And when you are doing the movements, you have to see your movements on the mirror of the normal side. This will create brain pattern. It will activate the bilateral movements of the hand, and thus how you would be able to activate your affected hands well. And this is how, with miraculous way, you would be able to get your movements back with the help of mirror therapy. That's why I say, yes, it's true. If you don't do physical activity as soon as possible, you won't be able to get all the benefits of recovery through physiotherapy, which I have already explained in this video. So you won't be able to walk, you won't be able to do all your functional tasks that you were doing before stroke attack if you don't start your physical activity and physiotherapy as soon as possible. So I have one request for you, my friend. If you are someone who is a stroke survivor, don't delay. Start your physiotherapy as soon as possible. On that note, I'll end this video here, and I'll see you in another video. Thank you.